Okay, I'm Jaclyn Hawkins. This is going to be my postpartum assessment. So I'm going to wash my hands, knock to enter the room, going to introduce myself. Hi there, I am Jaclyn. I'm a student nurse. If you don't mind, I'm going to be doing a postpartum assessment on you since you just had your baby. Is that okay?
Yes.
This assessment involves me having to touch you and look at different parts of you. Is that okay?
Yes.
Okay, so I'm going to wash my hands, ensure patient privacy, and I'm going to close curtains and close doors. Can you confirm your name and date of birth for me?
Cameron Hawkins, 8794.
Okay. So the patient is alert and oriented. Do you know where you're at today?
Yes.
Okay. Where are we?
In the hospital.
Okay. And what year is it?
2025.
Okay. So the patient is a GCS of 15. So while I'm doing my assessment, I would ask someone to help me, maybe another nurse or a nursing assistant, to get a set of vital signs for me. I want a temperature, blood pressure, heart rate, respiratory rate, oxygen saturation, and an O2. Did I say oxygen saturation? Temperature, heart rate, blood pressure, respiratory rate, and oxygen saturation. So I'm just going to do like a focused assessment. It's not going to be a complete head to toe. I wanted to take a look at your breast since you just had this baby. First, I want to know, was this a vaginal birth or a C-section that you had today?
Vaginal.
Okay. Did you feel like everything went really well?
Yes.
Okay. Are you super excited?
Oh, yeah.
Yeah. Okay. So I'm just going to take a look at your breast. Are you planning to breastfeed or are you going to bottle feed this baby?
Breastfeed.
Okay. So milk for babies usually starts to come in the next 2 to 3 days, but you will have what's called colostrum, which is like the super milk for these brand new babies. That's the stuff that you really want them to get if you can help it. So I want to take a look at the breast. I would touch the breast, assess for any tenderness or engorgement. So I would just kind of feel around. If this was a bottle feeding mom, I didn't really want to do this. I would take a look at the nipples and make sure that they're not like wounded, they wouldn't have lesions, irritation from trying to breastfeed, because that's a new kind of injury to the skin. I'm going to sit down next to you so I'm not breaking my back. So then after I have done that assessment, I want to assess the uterus. Within the first couple hours after birth, the uterus is assessed every 15 to 30 minutes. You want to make sure that we have a firm uterus and not a boggy uterus. If the uterus is not firming up, we are at risk of a maternal hemorrhage. So I would place my hand at the pubic symphysis down here, and this just protects the uterus from being pushed out. And then I would assess up here about the level of the umbilicus, which is going to be a little higher in a mom that just had a baby. And I'm just going to push down. You actually have to push pretty hard to feel the uterus and also feel that it is firming up. If I was to feel a boggy uterus, I do not let go, and I keep putting pressure and applying uterine massage until I feel that uterus firm up. If that is not happening, we are at risk of maternal hemorrhage, and somebody other than me needs to know, like the provider. So then we would come to bowel and bladder. Mom, have you peed since baby's been born?
Yes.
Do you feel like you emptied your bladder?
Yes.
Did you have any like burning with urination?
No.
You're not feeling like you're retaining any urine?
No.
Okay. Have you pooped since you got here?
Yes.
Did everything go okay? There's no blood in your poop?
Nope.
Okay. So mom is urinating and passing bowel movements as normal. Then I would assess for lochia. Lochia is the discharge that moms will have postpartum. So there's lochia rubra, serosa, and alba. A mom that is newly postpartum is going to be experiencing lochia rubra. I want to make sure that mom is not bleeding too much postpartum. Are you having like a lot of bleeding? Are you changing your pad more than once an hour?
No.
Do you feel like it's really heavy?
Mm-mm.
Okay. If mom was saturating that pad in an hour or less, we need to be concerned again about maternal hemorrhage. So then the serosa and alba come later. It is less blood and more of like the clear fluids that you pass after birth. So then we would assess, E is episiotomy, but they don't really do them anymore. So we would be assessing like if there was lacerations to the perineum, or perineum. I'm trying to say it like a flower. Of the perineum, did you have any lacerations? Do you know if they put any stitches?
No.
They didn't? Okay. In a mom that would have received sutures, we would be assessing for reta, which would be redness, edema, ecchymosis, or bruising. And then the discharge that moms can have. We also want to make sure that the tissues are approximated. So then we would assess for blood clots, which used to be Homan sign, but Miss Leake's video said we don't really assess Homan sign anymore. So I would look at both legs, seeing if there's any swelling or edema, especially if it's only unilateral. I would assess for redness, heat to the leg. Is one leg much larger than the other? Or is mom complaining of pain that really outweighs like what the situation is presenting with? And so, yeah, pain, redness, and swelling. If I find any of that, we need to let the doctor know because moms are at risk of blood clots after birth. Then I would ask mom about the emotional status. How are you feeling?
Okay.
You okay? Tired?
Mm-hmm.
Okay. Are you feeling like any sadness or just kind of feeling down?
No.
Or you feel like you're interacting well with the baby when the baby's in the room with you? Are you holding the baby?
Yep.
Feeding the baby? Okay. Do you feel down at all?
Nope.
Okay. If you start to feel just kind of down, we can sometimes call that like the postpartum blues. And that's a sign that we just need to be watching if you were to develop a postpartum depression, which is very common, but we want to make sure that we don't let you deal with that alone. So if you start to feel anything other than happy, definitely let us know. We're in about to crying, your hormones are all over the place. That can be normal, but as long as your overall feeling with the baby is happy, that's what we want to know. But if you have any other feelings, we definitely need to know.
Yeah.
Okay. So I would document my findings, wash my hands, make sure that the patient is comfortable in bed, make sure that personal belongings are with reach, pain is addressed, if that they're able to get up and go to the bathroom if they need to, how to contact me, do they have their call light, the bed is locked and lowered. And then I would wash my hands, exit the room, and document my findings.
Cool.
Oh.